I am recording, so meetings. Any questions? Hold on, I've got people asking me questions already. All right, so the process of how we're going to do is I'm going to introduce our guest speakers. They're going to be doing a PowerPoint presentation. Then there's going to be actually a live demo. Then we will open it up for some questions after that. So let me introduce. So I have Tracy Z here. She is the executive director to the Florida Board of Dentistry, and part of her role is she is the administrative officer for the Board of Dentistry. I have met Tracy. I was never lucky enough to work with her when I was on the board, but she's amazing, and we're blessed that she's here tonight. Now we have Jessica Nijam. Jessica and I go back a long, long way. Her and I did work together when I was on the Florida Board of Dentistry. She was the past executive director of the Board of Dentistry. She is now the Chief Bureau of Healthcare Practitioners Regulation. That is a mouthful. So Sue, I'm going to ask you to stop sharing your screen. And we'll allow. Jessica, are you able to share your screen? Excellent.
Okay, good evening, everybody. Kathy, are you ready to kick it off?
I am. So whenever you are ready, I did the intro. If you just put it on slideshow, we are ready to go.
Yes, give me 1 second.
No worries whatsoever. Okay.
Okay, looks like we're good to go. Good evening, everybody. As Kathy indicated, my name is Jessica, and I'm Chief of the Bureau of Healthcare Practitioner Regulation. We're definitely honored to be here this evening to give you an overview of the new background screening requirements. I'm also joined by my colleague, Tracy Z, who's the Executive Director for the board. So I'm going to kick this off and give just a high-level overview of the changes in the statute. So last year in 2024, during the 2024 legislative session, House Bill 975 was passed, and this established background screening requirements for all of our healthcare practitioners that we regulate at the Department of Health. There was a few professions that were excluded from this bill. That included registered pharmacy technicians, and our EMTs and paramedics. Outside of those three professions, all of our healthcare professions that we regulate are required now to be screened. This is a kind of a twofold requirement. Our practitioners beginning July 1st of 2025, prior to initial licensure, will be required to have a screening, be fingerprinted and be screened as part of their licensure process. So that's going to be new for this profession. Right now, we only screen a handful of practitioners, like our physicians or nurses, and some others. So at initial licensure, they go through a screening process at that time. After an individual is licensed with us at renewal, so when dentists and dental hygienists go to renew their license in February of 2026, we're going to be verifying that all licensees have valid fingerprints on file. And so we're going to be looking at this from the initial licensure side, and also upon renewal when a practitioner goes to renew their license. So I do want to note too that when an individual goes to renew, and for those of you that have been licensed for several years, you may remember when we moved to CE at renewal. We used to, way back when, we used to do audits, and probably about 10 years ago, we moved to verifying continuing education at renewal. This process is going to work very similar to that. When a licensee goes to renew their license, we're going to be doing a web call service to make sure our practitioners have valid prints on file. If you don't have those valid prints on file, your licensure renewal will not go through. So it's really important to understand this and know the timeline. Since this is a new requirement for this profession, it is important to know that the background screening process takes some time, especially if you do it. We have something called live scan vendors that do electronic fingerprinting. That's more of an efficient process, but we also have an option where individuals can go, for example, to a local police station, have your prints taken on a card, and that card is mailed to a vendor. So that process can take a little bit of time to match up and get through what we call the care provider clearinghouse. So it's just really important to start that process early to make sure when it comes time to your expiration date, you have all of your requirements, including your CEs, your fingerprints have processed, so you can renew your license seamlessly. I do want to note, though, fingerprints are good for 5 years. So you may not want to start too early, like right now, because that time period is going to start ticking away. So we're suggesting that licensees start their fingerprint process at the beginning of renewal, which will be November for dental hygienist and dentist. That's when your licensure renewal will open. And, this is kind of a staging process. We have to bring a lot of professions on board to do this renewal. And so it's kind of a phased staging process. So we do want to make sure that those professions, the time and the resources are allocated to those professions during the renewal. But also because your fingerprints are only good for 5 years. So you want to make sure that you can get the most out of the 5 years. I'm going to go ahead and turn it over to Tracy, and she's going to explain the registration process and how to initiate your screening.
Tracy, you are muted. Can you unmute yourself?
Sorry about that.
That's okay.
I don't know why. Okay.
You're there though.
Okay. Here we are. So yes, like Jessica was saying, my name's Tracy Z, and I am the executive director for the Board of Dentistry. And I think I may have gotten, nope, we're good. All right. So step one of the process is to, you want to register with the CHI system. So CHI is the clearinghouse applicant initiated system where licensees will have the ability to track their screening through CHI. And it is important to note that there is a difference between the application initiated user system and the provider initiated user system. So it's really important that individuals always click the link that we're providing here to initiate your background screening so that you know that you're using the correct pathway. We've already had a question come up with that, and then some individuals unable to register. And so that's where we found this out, that there are 2 separate pathways to be able to initiate with CHI. If you are a new user, you will be required to register for an account. A user guide with a step-by-step process of creating an account is located on our website at flhealthsource.gov/background screening. And that website will be available throughout this presentation as well. Once you've registered with CHI, your next step will be to schedule an appointment with a live scan provider. You can schedule an appointment within the CHI system or refer to our Locate a Provider tab at the webpage listed above. Our website is pretty easy to navigate. So if you click that locate a provider, it will provide a long list of providers that are in your area. Healthcare practitioners are responsible for the screening costs and should be aware that these fees may vary by service provider. On the day of your screening, please make sure that you bring your ORI number with you to your fingerprinting appointment. An originating agency identifier, known as your ORI, is the number that links your background screening results to the Florida board. So a profession-specific ORI numbers can be found on the webpage listed here. And if I have the dentistry ORI number available, and I can provide that at the end of the presentation. A transaction control number, also known as your TCN, is given to you by the LiveScan provider when you complete your fingerprint. You should keep this number safe as it may be needed to locate your results. The department will only need this TCN number if we are unable to locate your prints by your name or your social, but it is important for individuals to know that the department cannot retrieve the TCN if you lose it. So it's very important to make sure that you have that before you leave that appointment. Your TCN number can also be used to track the submission of your prints. So you can check the status of your screening with the Florida Department of Law Enforcement, FDLE, by entering in your TCN at the webpage listed here. If you're unable to view the status, please confirm with the LiveScan provider that they have submitted your fingerprints to FDLE and that your TCN number is correct. And you may search for your screenings completed within the last 6 months. So that TCN number is very, very important to keep track of. I'll talk about the privacy statement. I know a lot of, and this may affect a lot of people who already have a screening on file, but the Florida Department of Health can only access your completed background screening if you complete the required privacy statement. When applying for or renewing your license, you will be prompt to signing this privacy statement automatically online. And if the privacy statement is not received, we will not be able to retrieve your prints. So not signing this could delay your application for initial licensure or renewal. So in the event you already have prints on file, say as you're a Medicaid provider and you already have prints on file that are reported to the clearinghouse, and you've created your account with CHI, you see that you have fingerprints on file. When you go to renew, the only thing you will have to do is sign that privacy statement, and then your fingerprints will be retrieved and brought in with your renewal. Here's the contact information. If you have any questions, I will say that MQA's virtual agent Eli is the best way to learn about the licensure requirements and the background screening requirements. You can access Eli by locating him at the bottom right-hand corner device as you navigate through that web page. However, you can always email any questions you may have at mqa.backgroundscreen@flhelp.gov. And now I'm going to open it up for questions. I just want to say thank you again for allowing us the opportunity to present this evening. And before we open it up for questions, I know we've received some frequently asked questions. And one of the main ones was, how do we obtain fingerprints if you live out of state? So I'm going to stop sharing my screen and turn it over to Jessica. She's going to share her screen and show you how you can navigate through our webpage and how to have that done.
Okay, Tracy, can you just confirm, do you see my screen?
1 second. Yes, I see your screen.
Okay, so this is our main background screening webpage. And on this page, it introduces the fingerprint process. So if you're looking to locate a fingerprint provider, you'll click this tab, Locate a Provider. And it's got information about the new law. And this is going to, for in-state, this is going to break it down where you can find a live scan provider in the state. But if you're out of state, you can click this section where it says out of state, and it's going to give you some information about how to find a approved provider, either live scan or through the hard scanning process. I know it might be a little hard to see, but this heading is actually a drop-down list. And this is going to list all of the approved out-of-state providers. What I will say is that the live scan, that's the electronic fingerprinting, is limited out of state. There are plenty of options to do the hard card scanning. So you can just scroll through a list, try to locate a provider in your area if you're out of state. Or if you want to do the hard card, you can select a person, and I'm just gonna kind of walk through somebody's website. So I'm just gonna select here where I landed, Palm Beach Mobile Notary and Fingerprinting. It's gonna link you directly to their website. I will say a lot of these websites have a lot of information about fingerprinting on there, so you might have to kind of navigate through some of these. So on this page here, they have a tab for fingerprinting services. And if you click on their link, you have an option to find your ORI number, which you can do that on our website also. Now, if you're out of state and you're looking to do this from out of state, you're going to see different options on who you're trying to do fingerprints for. So the FDLE, ACA is one that may sound familiar. We even have Department of Health here. But for out of state, there is a tab here specifically for out of state fingerprinting. So when you click this link, it's going to bring up some detailed information about how to complete that. So here it has step-by-step physical mailing instructions. So this would be an example if you're in an area that does not have a live scan provider and you need to use that hard card option. This website and most of these vendor websites breaks down those instructions on how to get the card, how to fill out the registration form, where to go to complete that, and then where to send that back. So when you do your hard card scanning, you send it back to an approved vendor, and they transmit that into an electronic scan. And that way we're able to access your fingerprint results through the clearinghouse. Also, I want to note, if you do use the hard card option, it's important that you use a particular fingerprint card, and it's called an FD258 fingerprint card. But if you're going to one of our approved vendors, that website's going to have that specific information to make sure you get the right card. So just wanted to walk you guys through that process on locating a provider. And I believe, Ms. Cabinzon, that brings us to the end of our presentation, but I know that we have a lot of questions from your group. So I'll turn it over to you, Kathy, if you want to facilitate the questions and answers.
Let me see if I can. I'm not sure where Kathy is.
I think Kathy may have went.
Yeah,
Sue, do you want to do it?
okay.
I'm here. I'm sorry, I was muted. I was
Okay,
muted.
go ahead,
Okay.
Kathy.
All right. So if you did arrive a little bit late to the meeting and you might have a question that we did cover, it's okay. Put it in the chat. We can cover it again. So a question that I had received is, if you are a dental Medicaid provider who was screened for each credentialing period, will that suffice, or do they have to still go through this process?
I'll take this one, Jessica. Yes, if you have a background screening as a Medicaid provider, and that is reported to the clearinghouse, you will only have to complete your privacy statement upon renewing, as long as that screening is still valid.
Thank you. Second is, how do you do this if you reside in another state but are licensed in Florida? You covered that. That's great. I did have a question, wondered if dental assistants have to do this as well.
Okay, so dental assistants are not licensed by the department, therefore will not be required to complete the screening requirements. However, if a dental assistant obtains a dental radiographer certification with the board, they will be required to complete a background screening at initial certification beginning July 1st. But since dental radiographers do not renew, the current licensees will not be required to complete a background screening.
That's very interesting. And then how often is this done? Every biennium? You may have covered it, but I wanted to.
Yeah, so this was, so at every licensure renewal, we'll be verifying that you have a valid fingerprints on file. So once you're fingerprinted the first time, as long as you retain your prints every 5 years, you will not have to physically be reprinted. So retaining your fingerprints runs new national and state background checks so that results are stored in the clearinghouse and are current and valid. If fingerprints are not retained, they do a data purge, and therefore a new screening will be required to be completed. You can retain your prints every 5 years. So there's like a window to retain your prints, which opens up 75 days prior to the expiration date.
And that's the expiration date of your prints. So
Of
we
your
do have to
prints.
kind of navigate 2 different expiration dates, your licensure expiration date and also your print expiration date. And that's important to note for those practitioners who have been screened as a Medicaid provider. Those results still have to be valid. So again, that's that 5-year time period that we would be able to use that screening as long as it's within that 5-year time period. And you do the privacy statement, which can be done through your licensure, your Florida Department of Health licensure account. When you log on to your licensure account, there is a section called Manage My License, and you'll find an option for the privacy statement to be completed online. So we do have to have that privacy statement completed by you so that we can retrieve those results.
Thank you. There's another one. If I work for a county health department, I recall doing a background check within the last 6 months. Do you know if those fingerprints can be utilized for this new requirement? I believe we get them done every 5 years or so.
If that was done for employment purposes, the chances are those cannot be used. So, we get fingerprinted, if we volunteer for our kids' field trip at school. So those, like something like that, we would not be able to use those results. We can only use the fingerprinting results if they are stored in the care provider clearinghouse through the Agency for Healthcare Administration at ACA. So if that was done for employment purposes, we're most likely unable to use those fingerprinting results.
Next question. If I have signed up for the Florida Dental Convention in Orlando and signed up for the fingerprinting appointment, do we sign up ahead of time in the CHI or wait until we see them at the appointment time at the convention?
I would go ahead and register with CHI. Go ahead and do that ahead of time. And then that way you'll be able to track your fingerprints.
These are good questions. Regarding international options, when can I start the process? I am out of the country from May to mid-January, or can I do it before I leave?
You can certainly do that before you leave. You would rather take care of that now. There are options for doing the screening internationally, but if you do want to go ahead and take care of that before you leave the country, you can certainly do that.
Next question. Does this pertain to federal employees who work for the VA dental clinic?
This,
If you're licensed in Florida, then yes, it would pertain to you. There are certain federal licensure exemptions. If you're working in a VA facility, you may not be required to be licensed in Florida because you have a license in another state. So in that situation, you're not licensed with us, so we would not be screening you. But if you do hold a Florida license, then this would pertain to you.
Someone who had entered a little late into the meeting had asked, did you say how soon we should be able to begin this process?
We did. This is the fingerprint process. The CHI system is all up and active. However, we do recommend waiting a little closer to your renewal. One, because your fingerprints are only good for 5 years. So if you do it, you want to maximize your 5-year time period, but also because we are staggering this with all of our practitioners and tying that to their renewal. So, there's 3 agency partners that are working to implement this. Starts with FDLE, the Florida Department of Law Enforcement, ACA, Agency for Healthcare Administration, who has the Care Provider Clearinghouse, and then obviously us, the end receiver. So, we do want to be really careful about flooding, hundreds of thousands of practitioners through this system. We certainly don't want it to crash. So what is good about this bill, obviously we're, ensuring that we have safe practitioners, but the bill allowed the fingerprint requirements to be tied to renewal. So over the next 2 years, it allows for like a staggered implementation effect. So we do suggest waiting a little closer to your renewal, which will open in November.
Next question. Some of our adjunct instructors, obviously at one of the dental hygiene clinics, are new at our college, which requires fingerprinting and background checks. Will this suffice?
I think like Jessica said before, if it's for employment purposes, we can't guarantee that the fingerprints have to be done by an entity that reports to the clearinghouse.
Next question. How long is the processing time for the live scan? If you have more than one license under the Department of Health, do you only need to fingerprint once if they're dual licensed under DOH?
If you're dual licensed, you'll only have to sign the privacy statement when you're renewing your additional license. So you only have to have one screening on file. Now the actual length of time, I believe for the fingerprint process, it could take up to 72 hours from the time you're screened before it's available to us.
Next question. I started the registration on CHI. However, when I needed to provide the country of birth, my country was not listed. What should I do?
I may have to take that question back and do some research. I do have a contact at CHI, and I will notate that and get that one back to you, Kathy, because I'm not quite sure.
All right. So the person who asked that question, would you please send, I'm going to type in my email if you'll send me and let me know that that was you. So when Tracy responds, I can give that to you. All right. If you have been Medicaid screened and fingerprinted, how do you know that everything has been submitted to the clearinghouse? Is there a way to check?
Can you repeat that question? I'm sorry.
If you have been Medicaid screened and fingerprinted, how do you know that everything has been submitted to the clearinghouse? Is there a way to check?
Yes. So signing up with CHI is your best avenue. When you sign up for CHI, you will be able to know where you are in the steps. So if you sign up with CHI, you can check if you have prints on file. So if you sign up with CHI and you see I have an active fingerprint on file, then you don't have to due to being fingerprinted for Medicaid purposes. So when you go to renew your license, you will just have to sign that privacy statement.
I do want to say also, I want to add, as we get closer to the renewal cycle in November, we're going to be running a report with our agency partners to determine the practitioners that have valid prints on file. And so that'll be notated in our database. You're also going to get an email specific to those individuals, and that's going to say we've identified that you possibly have prints in the care provider clearinghouse. We just need you to go complete the privacy statement here. So we're going to be doing some back end work to try to match those individuals that already have those prints on file and let you know ahead of time and give you step-by-step instructions on filling out that privacy statement so that we can actually retrieve those prints. We're going to do that again closer to renewal sometime in November so we can make sure we have a good data match on all of those practitioners that may have that.
I have a few more. Regarding the new grads prior to applying for license to get fingerprinted, many of them have been fingerprinted for their program. Also, if this is effective for July 1st and they become licensed prior to July 1st, do they have to do it or will it roll till their next biennium renewal?
So if they were fingerprinted for their program, it's most likely we're not going to be able to use those prints because they will not be stored in the care provider clearinghouse. If they get licensed before July 1, no, they will not have to do the fingerprinting requirement for licensure. But when they go to renew their license in February of 2026, they will have to have valid prints on file. So they will have to do that for their renewal.
Excellent, because there's quite a few questions regarding the fingerprints of the hygiene programs if they would fit. It says a class that is a year graduates in August will be licensed around September, October. That same thing, if February renewal will apply. Can you show the QR code?
Kathy,
sorry. Yes.
Kathy, if you don't mind, so you just indicated that the class this year graduates in August. So if they're going to be licensed in the fall, then they'll have to have their fingerprinting done to get their initial license.
That's right, because July 1st. Thank you very much, Jessica. Can you show the QR code again for people who logged in late? That is for a survey. We will definitely show it at the end. How does the live scan work? For those who came in late, this will be recorded and it will be on the Floridians for Dental, the Florida Dental Hygiene Alliance website, and we'll let all of you know. I am the person who asked about the country of birth. And my name is Mal. I got you. Can you please explain the retaining prints process again? If you have time, Jessica, would that be okay? Or they could listen to the.
Sure. So your fingerprint results are good for 5 years. So once you get screened, those are good for 5 years. As you're coming up to your 5-year period, I think it's 75 days before, you're going to get a notification that says that your prints are about to expire and you're going to have to pay to retain those. And we are looking for an automated system moving forward that will be able to retain prints for all of our practitioners. So it's not like a manual process that everyone will have to do. That is not in place right now. It's something that we're looking forward to in the future. Maybe by your renewal time, we'll have that in place. But we're still working through those details. But for those of you that may have been screened to be a Medicaid provider in the last few years, if those are coming up for renewal, then you will need to make sure that you renew those prints so that we can use those.
All right. There's another question. Will there be a fingerprinting company rep at FDHA in Orlando Symposium in October? I don't know if you've heard of that or not, Miss Jessica. I think you would have to ask your association.
Yeah, yes, I'm not sure, but we can certainly work with the FDHA and we can find out. And just to clarify, are we talking about like a mobile fingerprinting company?
I think they're talking about the same thing that's at FMDC.
Oh, okay. Okay.
Okay. May I ask why the need for every 5 years for renewal? Our fingerprints don't change. I'm needing some more clarification on that.
The 5 years, that's a requirement outlined in law that's tied to like the FDLE and the FBI's fingerprints. So every 5 years, we run your prints, or the Florida Department of Law Enforcement runs your prints again to see if there are new offenses or if anything has occurred from those original, the original time that you were screened. So every 5 years, essentially, your background is written again.
Okay, this question is a typical question that gets confused, how people get confused by, because when they say a law is effective by, they figure they must do it by. So I thought you said we needed to have this done by July 2025, but you recommended initiating the process in November or closer to the renewal.
Sure, that's correct. So this law does become effective July 1 of 2025, but it is tied to all of our practitioners, all of the professions renewal. So even though the law is effective July 1 of 2025 for our new licensees, beginning on that date, they're going to have to be screened when they come to us to obtain their licensure. Then for those that are already licensed, we're going to pick up that screening when you go to renew your license.
Thank you. And I do believe we have gone through our questions. Sue, if you want to share the QR code for our survey, it's not the CHI QR code.
And actually, the only reason I brought it up that, because I had actually accessed that QR code on my phone, and it did bring me to the clearinghouse. So I think that's might be what the one participant was
Okay.
inquiring about, was that QR code.
You want to show it again then?
Sure. I
Yeah,
don't,
that's
can Tracy or Jessica, can you share that particular slide again? If it's
Sure.
not too much trouble?
Yep.
Sure.
Yeah, we can pull that back up.
Thank you. Just takes a second for screen sharing, so be patient.
Yes. And we are talking about this QR code, correct?
Correct. That's
I
it.
believe that's it. All right, we're going to take one more question because we are past time and I do want to respect our speakers. Looking at my out-of-state approved location, would I select AHCA, reason when booking? There is also an option for FLMQA when booking at this out-of-state location field print.
So if you're on one of the vendors' websites, you're going to see many different options. And if you're out of state, they should have a tab for out of state or hard card scanning. And so you'll want to select the out of state option.
All right, and then I do have someone who has asked, what is the best way to reach you guys? The Board of Dentistry, if we have questions.
Yeah, maybe Tracy, we can share that contact slide again. If you have questions about the background screening, we certainly want to funnel those through our background screening email address. So we'll throw that back up on the screen so everyone can jot that down.
And everyone, again, this will be recorded, put on the website for the Florida Dental Hygiene Alliance. I know that some people did have trouble getting in because there was a confusion with some links that came out. So please, once the recording is up, we will get it to you. You can watch it all and you'll be able to hear all of these questions as well. And this is the scan for our survey link. So please, I know there are no CEs to this because it is educational about licensure renewal, but we still would like to hear from you and any ideas for any future webinars. Jessica, Tracy, thank you so much for your time. Thank you everyone for joining us, and we hope this helped. Sue, Alan, thank you.
Thank you for
Thank
having
you
us.
so much.
Thank you.
Thank you so much, everyone.
Yeah,
I'll be sending out an email with the
Um,
QR code.
however,
Jessica, I'm going to go ahead and I'll send out a link to the clearinghouse as well as to our Survey Monkey. Thank you, everyone.
Have a good evening, everyone.
Thank you. Have a good
Bye.
evening.
Thank you.
Bye-bye.
Bye-bye.